have been instructed that we are starting off way behind time.
We are.
And so we are going to get this party started.
So this is a building a support system, and this is really from the medical professionals here that can help you after a new diagnosis, or even as you're going through, if you don't have the help that you need, or if you need more help, how to find those kinds of things, and what to do to really build your support system up. Thank you.
I think maybe we have not rehearsed this well. We should start with maybe even just cataloging what supports you feel are needed, whether or not you've achieved them, so that we just have some sense about what you feel are the things that would help this process work better. I think you had a lot of nice thoughts in the last hour, which I know everybody's going to get a copy of, but what are the things you need that did or didn't work? Just a list. I'm going to write on Roberta's copy of it. It's okay if I write on this?
I did forget to mention the spit kit 30-minute thing.
Oh, if anyone is going to do the spit kit for the renal studies, you have to stop eating or drinking 35 minutes before you spit, because you can't have the DNA from your sausage in the, no, seriously.
And that's from 9:30 to 10:30, so you
Right.
have some time.
So water only, yes, DNA-less water. Philadelphia water sometimes has DNA in it, so, you know. Okay, supports. Let's go. What are the things you need? You need a supportive caregiver. You need a supportive physician, nurse, social worker, dietitian, and so on. You need a supportive employer who cuts you a break when you have to go to visits. You need a supportive in-law to come in and babysit. You need somebody to stay up all night so you can get one sleep. Bring it on. Come on. Interactive. Let's go. Yes.
Here, hold on. Let me get the mic. This is live webcasted, by the way.
Oh, okay. So supportive hospital staff and resources in the hospital, because one of the problems that I know I run into a lot is my husband works full-time, and if I'm in the hospital alone with her, it's me and her, and I can't pee, and I can't eat, and I can't go anywhere because I'm caring for my child. So we need resources, I feel like, in the hospital to help us care for our kids while we take a break.
Who are the important team members in the hospital that you feel are supportive? And maybe just quick show of hands. We might not love this feedback. Your physician, supportive? Not very supportive? Your nurses on the team, supportive? Who has a social worker who's involved with you? Wow. Dietitian? Specific dietitian? Psychologist? Psychologist for your child? Psychologist for you? Which hospitals make special financial considerations for you? Parking, meal coupons, stuff like that? Yeah, not in the USA, I guess. Okay, we could probably do a little better with that. How about supportive schedulers who get you 3 appointments on the same day? Okay, wow, that's a little better than I thought. Okay, good. What other things do you feel that your hospital or your practitioner supports your disease in some special way? Education days or, okay. Which hospitals give you the hospital gives you a case manager, someone who helps you work through insurance, pre-cert and prior auth. Cincinnati, okay, we're all coming here. today. What about from your insurance company? Who has a case manager who's they're helping to do a lot of things, but one of them is limit their own costs, but yes. Okay, all right. So in that realm, outside of the family, in the healthcare system, what other things that we just didn't mention should we have mentioned? Yes?
Maybe appeals to insurance companies for coverage items.
Yeah. How many people your physician will advocate to get you the care or the coverage that you need? That's pretty decent. People know when we write those letters and it says your kid's gonna like DIE if they don't provide the vitamin E, you know we don't always like exactly stretch the truth a little bit. Okay, anything else from the hospital?
Sorry. Can I say something else about that?
Yeah.
I was told by an insurance case manager that might not have been supposed to tell me this, but she said, you did a second appeal, right? And I said, no, they denied my first appeal. She says, oh, honey, they haven't even looked at it yet.
That's exactly right. Oh, that is totally. Your first shot, never. It's hit me with your best shot, and it's always at least the second one. And never give in and never say die. Absolutely. Yeah. What else? Oh, we totally. Child life can make a blood draw seem like the best event of the day. Yeah. Who has child life that helps in your, yeah. Yeah, they are golden. Yeah. Therapeutic clowns. Okay.
Who has therapeutic crowns? Yeah?
You mean in our government or? Oh, sorry. We're not recording this, are we?
We have therapeutic pets.
Oh, pet therapy. Yeah.
Visiting dogs that we have.
What else decreases the stress on your child? What's in your exam room that helps you survive the 2-hour wait? Yes, guest internet is parents can't, I mean, you have to do your business and your life when you're in the hospital. Yeah, guest internet.
We had a sedated MRI, and the anesthesiologist let a friend come with our daughter all the way until she was asleep. We went all the way into the MRI room, and it didn't help, but it was a nice thought.
Yeah, no, it's interesting that you say that. I mean, we, in our GI suite and, liver biopsies and so on, the parents go into the room until the kid is out. That's like, I'm surprised to hear that's not kind of standard.
They let her 9-year-old friend come.
Oh, it's like a kid.
Yes.
But you also?
Oh, yeah.
Yeah, oh, okay. Thought you delegated the, no. What else? What are some other good ideas? Yeah.
Since he has to go to hospital so often, and I'm working and I'm divorced, it's hard for me to be there at every appointment. And sometimes I've got a person that I trust a lot who lives with us, and she also helps me going to the appointments that I know I don't have to go. Like if I had an appointment with another anesthesiologist, I would always do it myself. But if it's just a checkup with a allergologist or a pneumologist, then maybe I send her. And sometimes I find these doctors, and mostly women, which is very sad to me, that are not understanding of where is the mom? I want to talk to the mom. She should have come. And it's like, doctor, I have 8 appointments a month. I cannot come to every single one. So if doctors are a little bit understanding of us just not being able to attend every single appointment, that would help.
Yeah, that's important. The other side of that coin, was the other question that I had asked, is there a group, our group's called Complex Care Scheduling, where they leverage and they say whichever one of those is most important and most rare, if they're seeing you on Tuesday, then this group says, you know, low person on the totem pole, GI hepatology, you have to see them on Tuesday, you have to see them on Tuesday, and then it's a long day, but you get 7 of those done in one day, and you only take one day off, you know, particularly if you drive 3 hours to, you know, I mean, even on the East Coast, a lot of people drive 3 hours to get to their, you know, appointment. On the West Coast or the Midwest, it's kind of standard, right? Sometimes you fly. All right, what else should? I think, because I think we make a list of these, and then Roberta send it out and have everybody go back. I think a lot of times you're surprised that these things exist and you don't know it. I think one of the big flaws is we don't push out all the things. They have to be pulled. Certainly with insurance, you have to really push almost to the point where you're not the pleasant, wonderful person that you are at home.
And when we do get a new diagnosis, a lot of times we see in the community, the new diagnosis then, of course, leads to several appointments, and those appointments build up, and sometimes the specialists are in different spots, and sometimes those drives are very long, and then jobs, they suffer, and finances then suffer. And even from there, you know, our families are really falling apart at just the foundation sometimes. And I think a lot of times families forget that there are resources, even in the community, that you can reach out to for simple things like car repair and, you know, WIC that would help with the formula and all of these other little programs as
WIC,
well. Yeah.
Medicaid is a secondary. Other support things that will cover costs. Yeah.
The problem with these things is the paperwork and the maintenance to maintain these programs is extremely difficult. Mileage, extremely difficult to get. And sometimes people wait months to get the money back on that. So what do you guys see in the community that our physicians or doctors or clinicians or anyone can help you do, you know, to facilitate making these better? Is it getting resources? What is it?
I think someone who can help us navigate the system and tell us what's available in our specific area and how it works and what the requirements are and what we need to get so that we're prepared for when we ask for the help. We go with everything that we need. We don't have to go back 300 times. And if there's anything we can do over the web, because of course we're always on our cell phones and our smartphones, and if it doesn't require, you know, traveling anywhere, that's more comfortable. But yes, maybe putting together with social work a list of resources that are available in your area that could help with all of these other expenses, or even how to get a case manager in insurance and how to get a case manager in a hospital when you're in the hospital, or how to get a complex care to get everybody in line and only have one day of appointments.
Dr. Kamal.
No, I don't have an answer. I have a question. You know, maybe this may be too out of the box, but would people benefit from some type of somebody who was specialized, a tax accountant that specialized in chronic disease or rare disease? Because so I have a child with a mild but chronic disease for which there is a tax benefit associated with her diet, and I have never been able to figure out how to do the tax on it. And I can't figure that out, and I have never taken advantage of it. And I wonder, because there are, all the countries that we live in, different countries, there are sometimes things that are available that we don't know how to access. And I wonder if that would be a resource. I don't know if Nord or somewhere like that knows about things like that families could apply for that could help. Or does anybody know how to do this? Because I haven't figured it out, so.
This just goes back to the complex care. So I get all my appointments. There's no one at my hospital that coordinates them other than me calling and saying, I have I need to see this doctor, and this doctor. You, the scheduler for this doctor, call the other two. I need it on a Tuesday or a Thursday, and you tell me when you can do it. And so I am just forward enough that they do not, and if they try to tell me we don't do that, I say, too bad, I'm not coming more than once. And do our blood draw and x-ray while we're there if you want one. And so for her formula as well, this last 2 years ago, my insurance company decided to write enteral formula out of our insurance plan, to which I've appealed all the way through, then went and sat down with my company, who is a large corporation that is self-insured, that didn't realize what they wrote out of the plan.
They never
because
do. They never do. That's a huge problem.
They actually covered all of her tube feeding supplies, the tube, all the medicine, to get it in the tube, but not the food to keep her alive. So once I explained that to my corporation, they immediately wrote it back in the plan for everyone. They just didn't know what they did when they wrote it out of the plan.
Yeah. And that is great if your employer is powerful and negotiates with the insurance company. And
Well,
if
we're
you're in
self-insured, so they just needed to write it back in.
Yes, and sort of. You're self-insured, CHOP is self-insured. But we're self-insured, we bargain with 4 different insurance companies, and we tell them, and they tell us, and people fight, and then they, make the art of the deal at the end. But it's exactly the people doing those negotiations commonly don't know what is in or out. The other thing, though, is that if you're in a company and you have a case manager within the company, and that person's job is to help facilitate care, but it's also to decrease the cost of care, sometimes they will just say, oh, Mrs. Brinson, we will send you 20 cases of Pediasure. And that way they haven't made something for the other 1,000 people in your company, but they recognize they made a little bit of a mistake for you. Sometimes also you can send, your story to X, Y, or Z and get 3 months worth of samples, which cost those people nothing. And so whether that's vitamin E or Pediasure or whatever, and then commonly those things are covered by Medicaid as a secondary, even though your very expensive insurance policy won't cover it. It's amazing the disparities. Like WIC covers like everything. Like, wow, So, it depends on the WIC and things that are state by state. It's important to know what your state does, but sometimes you'll move across a river, you'll be in a different state, and you lose something huge, or there's something great that you don't know about. Yeah.
In terms of the social work and finding that, in our case, our daughter was referred for PT with Easter seals when she was like 6 months old, had no idea what was going on. A lady showed up and she was like, oh yeah, we'll look at this, and do you have a social worker? I don't even know what you're saying. And so this other lady showed up at my house a couple of weeks later, and she said, well, do you have respite care? Do you have this? Do you have? I said, I don't even know what you're talking about. And then within 3 or 4 months, she had walked us through the Medicaid waiver program, the SSI disability application. She literally went to the SSI office with me. And so now, 7 years later, I have people asking me, well, how do you file for MDCP as the program in Texas and with the Medicaid waiver? And I said, I don't know. I had a magic fairy who did this, but that lady's no longer with Easter Seals. So
It's interesting. So that's an unbelievably important point. Roberta has promised on the #1 Alagille hit on Google, which she's going to create, that we should make the list of these with the 2-sentence about, if you have gross motor delay, you automatically qualify for that. And not every, but, many, when you saw the dips that Benita showed and everything, right off the bat, you get classified as that, and you can get those services usually for free, and then they open up all kinds of other things that you need. Or you could have a social worker at your hospital who has a list of those. I mean, I have to say for us as providers, we get lost in that stuff, but there are professionals whose whole job is to help you secure those services. And a list of just knowing what's possible. You know, I mean, the idea of buying your medicine directly from the company or crushing a pill that can be crushed rather than paying a compounding pharmacy out of pocket $400 a month. You know, those are things that, it's like, that's what you learn in these kind of things. You're like, oh, I don't do that. I bought a mortar and pestle, $3, you know. So we should really have a list of tips and tricks for survival, you know.
Can we talk about the mental health of the parents? Is, you know, how, would you have a recommendation that right out of the gate with a new diagnosis, a recommendation to see a therapist or seek one out to help them go through this journey knowing that they have tools to help cope?
Yeah, I'm going to trade places with someone else, Benita, so that you have a mic. You know, for us, we in our division, it's a big division, not just liver, but like GI. We have 8 full-time psychologists in the division, and we have 13 psychologists for our programs. They are officially focused on the child, but they all do family therapy, and they all recognize that, you know, in the 3-year-old, sometimes the stresses are 10 times more on the parents than they are, you know, what you're doing with the child. It is hard to get good, affordable adult psychology, disease-oriented services. It's just hard. Most of the psychologists are not focused on it's because we have a huge disease that we need to learn these adaptive, you know, kind of behaviors. We have a list, and I think that, you know, your pediatrician might have a list, your internist might have a list. You know, you want somebody, and you want somebody who looks at the whole family unit, because there's how I deal with the child, how my other caregiver, spouse, whatever, deals with the child, how we now are dealing or not dealing with each other, you know, all those different things. So you need marital counseling, you need, you know, PTSD, you need, you know, how do we do the things that we have to do, and how do we give control for the things.
So our specialists should be able to give a list to the families.
Should is an
Okay.
operative word.
They could, so they can ask.
It would, yeah, that's.
Ruben, I see.
Yeah, I will add that when you asked about like how many of you had involved a social worker, I was shocked that not many of you has been.
Yeah, me too.
Yeah, and I think at least in my institution, it's a nice resource. Because at the beginning, you want to be left alone, pretty much. I mean, it's what usually happens, and you have to respect that. But when you have a social worker, it starts navigating with you some of the things that you may have available resources in the community. At least that's what we have. And as you establish that relationship, she may identify, or he may identify, that's what is happening, and sometimes come back to me, and then we start creating plans of potential more resources. Or she had a list of resources that they were saying in his institution of places that you could go if you have A, B, C, and D. I think case managers sometimes do that also. Some institutions have that. We start having some of that. But I think it's something that perhaps you should start looking into the place you go is where is a social worker? Who is that person? And at least identify with her or him, obviously.
Thank you. And a lot of our families have sometimes medical equipment that needs to be supplied. It's not covered by insurance. And, you know, it's important that our families know there are other nonprofits that help cover those. And if you Google medical supply or rare disease medical supply or any of those things, just utilizing the internet to find those resources can be huge. Can you guys speak to that? You know, how families really do have opportunity, they just have to be able to look for them?
Okay, well, I think it's all of this is advice. It comes from a good heart. I mean, not here to criticize anyone. I think it's really rough to deal with a chronic illness as it is. I think something I find at times is that you have to pass that phase of shock or trauma or so forth, but you start to, like we talked this morning, you have to advocate. You have to be that person that your child is going to benefit more from. And you have to look for resources, go to the websites, ask, as we've seen here, there's nothing more powerful than a parent that won't go away, because he wants to persist and doing things. I think everybody will start helping you. You will find someone. You keep on asking, keep on looking for it. The websites are very helpful. I think in the Alianza website, they are going to add more information, as I've been saying earlier. But you have to do this because, unfortunately, no one is going to be the best advocate person for your child. And I think you have to do that. And look for resources. Sometimes you cannot do it by yourself. Then you need to find someone else to help you. Find that networking and so forth. But I think a lot is going to be, unfortunately, on you. But I think as you start working this path, what I found is some of my parents, they start finding resources that I didn't even have idea that they existed. And then I start learning myself. And then I can use that for future patients with the same problem.
Thank you.
Yep.
Yes, let me get you the mic.
A couple years ago, I was in a cardiologist's office with my daughter, and her heart had gotten, like the stenosis had closed, like a lot of the Alagille was getting better in her heart. And, but she wanted to order an echo of the heart, and her comment to me was, we're gonna have to wait for insurance, because I'm gonna have to argue with them, because for some reason, I have to explain to a 24-year-old on the other side of the insurance why I want this test. I'm the doctor. This should be my call. They cover, they're supposed to cover this. Why should I have, my overall, as much as I appreciate the advocacy she did for my child, the problem was she's spending time with advocacy when she should be spending time with patients. How do we fix this?
I would say this, and I think we hate to be like whiny. Families have no idea how many hours a week we waste. And I would pray for a 24-year-old who seemed even lightly knowledgeable about what we were talking about. We commonly are talking to people who have no clue, and we do this all the time. And sometimes I have to say, because I was unhappy, since I don't have leverage with the insurance companies, I have some leverage with my own hospital administrators. They always say at the start of these calls, we are taping this for quality and educational purposes. And I always say to the machine, I'm taping it too. I'm recording it as well. And then I make some of our administrators listen to an hour and 15 minutes. I could play it right here because it's still on my phone. For one approval, just, and I'll like eat lunch. It's unbelievable. It's a way to contain costs. It's unnecessary. And a lot of times, the truth of the matter is the payers put up impediments to see how hard, as Mrs. Brinson said, are you going to come back at me a second time? And yeah, so I have to pre-cert every radiology that's not done at my institution even though I'm not the radiologist. And you just stack these things up. It should get fixed. It should be standard. This form should all be the same. It's a disaster, and I appreciate the fact that you appreciate how horrible it is, because in the end, they never deny us, because we don't ever back down. I mean, it's like, you know, but they have these rules, and you have to give like 15 numbers 10 different times. They pass you from person to person. I mean, literally, my head wants to explode when I do this, and I'm sure Kathy will say the same, Ruben will say the same. Benita probably is in a much smarter system, whereas if a cardiologist thinks your child with cardiac disease needs a cardiac echo, that they probably just get one. Right, Benita?
Yeah, we don't do that.
Oh, my God.
Sorry.
Yeah,
One
Yeah.
solution is move to Canada.
yeah.
Sorry.
In closing, also, what can we do as families to make our visits better for you? So part of the thing is, you know, we see our doctors, and if we feel things aren't going okay with our child, sometimes that anger and resentment is towards you. And it shouldn't always be that way. And we want to be sure that our families understand, you know, that this is, when we come to see you, we want to have a good relationship, open communication, and what can we do as parents? What's the message you would give people watching that you would like to see with the families? We also have to understand what it's like for you guys in the clinic setting.
Dr. Kamath.
Okay, no. So I have to say, I have tremendously good relationships with my families. I do not feel, I know that there's frustration, I know there's resentment, I don't ever feel it. However, I do sometimes hear from my schedulers, nurses, nurse practitioners, that some of that resentment sometimes spills over. And actually what I would say is I'd rather it came to me, because I'm more likely to be in a situation to do something about it. And this is not common, but it does, and it's not specific to Alagille syndrome, but it's more since you're asking generally about patient care, that sometimes when families are frustrated, they find it easier to take it out on ancillary staff and then don't say it to the doctor. So I can have my nurse go in and get reamed out by a family for something, often a scheduling issue, and I'll walk in and it's all smiles and happy. And I would say, you know, take it to the top, because, I mean, we're not really the top, but we can at least access the top, perhaps. But just remember that even the lowest person on the totem pole, like the volunteer who's at the scheduling desk at the front, is part of the healthcare team. And just because I'm the physician, you don't have to sort of play nice with me, but then not be nice to them. So I would rather hear about the issues than have my ancillary staff come to me in tears, because that's what sometimes happens. So don't be afraid to tell us. I think that's what I would say. If there's a problem with a scheduler, if there's a problem somewhere, bring it to us.
I think in the office visit itself, the preparation on both sides is really important. The practitioner should read the chart, review what happened last time, look at the plan, and say, you know, what should have happened, what should have transpired, and what probably are we going to do. And, you know, I think many people now, because again, this is another sort of part of that Affordable Care Act, probably most people get written instructions now at the end of a visit, written list of your meds, you know, things that, you know, it's sort of a requirement, but it makes a lot of sense. I think from the family side, what do you want to get out of this visit? And it might just be, I just want to see my ALT and AST and see if my GGT and see if my transplant is okay. Or it might be 5 questions, and then don't lead with the unimportant question or the question about something that is not in that person's area of expertise, or, you know, Uncle Charlie had a heart attack in Arizona, do you know a cardiologist there, kind of thing. Figure out how to maximize the use of that time. I want to know about this, I read about this, I think this medicine is doing this. And sometimes 2 hours after you're parking and doing registering and all this other stuff, you sit down and you're exhausted and you walk out and you forgot there were two really important things you wanted the information from, and, you know. Some people, my chart in advance of the visit, this is what I want to cover, and then both sides are prepared, and, you know, and that's a really good thing, too. I mean, they just can't go for 2 hours, so try to get high-value communication and care. And I think in the office visit, let your kid have a voice. It's important for the practitioner to focus and directly talk to the child more and more as they get older, but let them feel like they have some input into the case. I think when you're really smart parents and it's complicated disease, kid can kind of be in the corner and everybody's over here talking. I would say the other thing, just from my point of view, and maybe it's just because I'm really old, like when we're doing the whole family thing, it would be great if the child would put down the iPhone or the telephone, because we're in this, whatever how many minutes it's going to be, when you're waiting for us or when you want to talk in secret, have them put in their earbuds and, you know, but, you know, it's amazing sometimes we'll have a 15-year-old who should know what we're talking about, and they've got their earphones in and their iPads on. And, you know, sometimes we say, put that away, but that would really be great if that was a parent thing to say to your child, this is your care, you should understand it, you know, when we're doing the talk about you or the talk to you. Shut off your iPad, and don't wait until you can pause it because you just jumped over some wall.
Thank you. So for building your support system, we talked about finding local resources, talked about utilizing the medical staff, medical team here to find those resources within their system as well. It's important to have, you know, just friends, family, and gosh, let's see. We've talked about WIC. There's opportunity for medical supplies, car repair, financial help. There's all sorts of stuff. So we've really got to just look and use these guys to help locate those resources. Thank you.
I think it's important to say everything we just talked about is generic support. It doesn't matter you have biliary atresia, anything else. The really great advance in support for Alagille syndrome is the alliance and each other and all the ways that you communicate with families outside of us for specific, content-specific information. And I think that's like the best kind of support. We really talk about like family to family, but of course that's why you're all here. But I think that can't be overemphasized how important that is, that you can reach out to other people with similar issues, similar scenarios for either support, education, tricks, or just empathy, you know.
Thank you. Next up, IEPs. We need just about 5 minutes.